And here we are on one more Tuesdays for Facilitation. This is the third episode of the second season of yours truly, Tuesday to talk about facilitation. This season is all in English, so I'm traveling around the world, mostly between Europe and Africa. So we have a stop in Nigeria again today with Nonye. Nonye, good morning.
Good morning, Ty. Good to see you again.
Great to see you. I met Noni while I was on my trip in Nigeria last month. We bonded and now we have a partnership, an international partnership with Awele. So I had to invite her, especially because I was telling her I've never invited someone from the healthcare industry on this show. So Noni, to start off, everyone that arrives here has to answer this very important question, which is how do you show up when you facilitate?
Thank you, Ty. I try to just come up just as I am and melt into the room. What do I mean by that? I read the room. Very, very important. Your communication skill is very important as a facilitator. So I read into the room, I bled into the room, and I come up with icebreakers, try to warm up the room, make sure everybody is at the same level. Because the health sector already has a lot of things going on there, right? So when you show up as a facilitator in a healthcare setting, you just have to somehow for a minute take them away from what's happening at work and let them know, yes, we are here to do something else and make it easy for them to be able to get ready and flow into the session that we are going to be having. So that's typically how I come up. And most of the times, by the time we do introductions, it helps a lot. Everybody eases up. You find out what the person is doing, the arm the person is coming in, because the health sector, there are a lot of professionals. That's one area that has a lot of professionals working in. So by the time we do that, everybody's at home. Everybody's like, oh, wow, okay, so I'm ready for this session. And then we hit the road running. So that's it.
This is very interesting because I see the health industry as something very stiff, right? So I think
Mm,
being able to blend in and being able
yeah,
to sit down and talk with this high level
yeah,
professionals, it's tough, right? Um,
exactly.
I see facilitation as something more fluid, more free. And I find it very interesting and challenging to do it in different industries, right? Especially the ones that are strict and with protocols. I've even posted that I normally, when I'm talking about chaos and order, I use like the health industry as a place which has extreme order because, anything that goes out of space, it might mean the life of someone. How do you manage to invite participants from these strict protocols, from these strict ways
Yes,
of doing things,
yeah.
to a more fluid, a more creative, a more innovative mind space? How do you manage to invite them from one mind space to the other?
Yes, just like I've mentioned before, we have a lot of disciplines in the health sector. So you're very right. There are a lot of SOPs, protocols. So I tell them to bring on the protocols, and then I tell them to bring a case. You get a case that has happened in the hospital around what we are talking about, around what the session is about, and then we look in to see how we can link that case to the protocol, and then it makes it very easy for them to see. All right, so that's the way it works. Once you make it easy with them with the use cases or the problems they are trying to solve, why we've been invited, then it breaks down the protocols and they're able to see, oh, so this is what it's about. And then they can now say, oh, this is how we should go about it, because it's actually about how and why that thing is happening or what you want to do. Those are the two most important things. So yes, we have protocols, be it in the clinic area, in the laboratory, in the nursing area, or at the storage area, but able to merge it with what is happening, because that's the only way to make sense to them. If you're just talking and reading theory, then that's when it becomes, yes, like a protocol thing. But when you link it with what is happening in that facility, then they are able to see that, and then the pieces, the puzzle starts coming together, and then we come up with something at the end of the day. So that's typically what we do. If you don't do it that way, it's very hard, and they are not. You can come and facilitate, do what you want to do, and whatever is happening still happens there. But when you do it that way, then you break it down because there are a lot of things happening. And at the end of the day, you may find out that it's a storage problem that is causing that problem that has just come up. Or you could find out that it's a staffing problem that is causing that issue that we are discussing at the moment. So that's typically how I go about breaking down the protocols and making them to feel easy from one thing to the other.
That's
Yeah.
very cool. So it's like bringing it to real life, right?
Yes.
You've been through it.
Exactly.
So it's interesting because sometimes when we're facilitating, what we do to take people from one mindset to the other is to take them completely far away from what they do on your day-to-day life. And you're doing exactly the opposite, which is a very interesting strategy. It's like, let's, instead of taking you far so that I can take your head elsewhere, I'm going to take you in. We're going to dive into your problems. We're going to dive into what your team, your sector, your area is already going through, and with that, we are going to flourish. That's very cool. That's very cool.
Thank you, Kai.
So you describe yourself as a systems thinker, right? And in a field, in the healthcare field, which is a field that's increasingly digitalized and data heavy, right? How does facilitation act as a bridge that ensure that the healthcare solutions remain people driven, rather than just protocol or policy driven?
Okay, thank you, Tai. The health sector has 6 pillars on which it is built upon. So if you are going to facilitate, it has to revolve around those 6 pillars. So you have the service, the quality of the service, you have financing, you have leadership, you have the information management system, whether it's the hospital or the laboratory, and you have the access to medicine and technologies, So when you are looking at this system, it's facility specific. What I mean by that is that what you meet in one health facility is not the same thing you are going to meet in another facility, because it's going to depend on what they do. Is it a clinic? Is it a hospital? Is it a diagnostic center that's imaging and laboratory? Is it just a medical laboratory, right? Is it a physiotherapy clinic, or is it a prosthetic or orthotic industry? So depending on what you find, will now take you to how to link them through those systems, because it may be one of the pillars that is shining bright, and then when you look at it, then you find out that there's something. Let me give you a very typical example that is very common in the health industry: the front desk. Front desk is usually, especially here in Nigeria, you see a lot of people waiting in the front desk area, right? And then by the time we get to start talking with them, you find out that usually the problem is the front desk officer is trying to do the work of receiving the patients, giving instructions, getting to giving answers to inquiries, taking payments in some places. So by the time you come in, you tell them, hold on, the front desk should be front desk. Why don't you get somebody else that will just do the work of a cashier? Yes, in some places you have people that have that, but sometimes when some of them start growing, they don't realize that it's a problem. Because when one person is taking inquiries, when one person is getting the details of the patient, that same person is also taking payment. There's a lot of people in the waiting area. All right. So by the time you let them know that, then they now say, oh, okay, so there's a problem with payment, and that may be the problem. So you tease that out, and then of course you have told them, yes, they have to get some other person to handle that. And usually in most places we've worked, by the time they implement that, they find out that the waiting area decongests just because of that. They didn't think through around that. So by the time we do that, they find that's the problem. Then sometimes you also find it could be the issue of we're not really seeing through what is happening in the facility in terms of numbers. And then you get to ask them, how is your inventory? Who does the procurement, right? Is there any record? Because we use a lot of things in the health sector. You have the syringes, you have the needles, you have the pipette tips, you have the gloves, you have the drugs, a whole lot of things. Who is keeping record? Do you know the volume of each of these items that you use in a day? Who matches it with what has been procured? Are there checks and balances? So that's usually the issue. Then sometimes it could be an issue of, like you mentioned before, protocol. And then by the time you start talking with them, you find out that issue is service delivery, quality. Is there somebody in charge of that? Is there somebody making sure that A worker does exactly what the B worker does? Because like you mentioned at the beginning, the health sector is very sensitive. Just a little mistake, a life is gone. So that is the way we bring in these different disciplines to work together to actually make sure that there's cohesion, to make sure there's effective service delivery and the patient has an awesome experience. So I don't know if that helps to bring that to perspective.
No, that totally does. I would like to tell you just two things before we go on.
Okay.
I got some messages here on LinkedIn. Nancy said, super glad to be here. Good morning, Nancy.
Oh,
Just so you
Nancy,
know,
welcome.
just so you know that you're on LinkedIn, we have like a 2 or 3 seconds delay. So we are here, we are live. I'm seeing your messages. Someone sent blessings. I don't know why
Okay.
StreamYard is not showing the name. Someone
Okay.
said, to facilitate, I come intentional. Intentional is good. The
Yes.
intended effect. And then AJ, proper inventory management. Yeah,
Absolutely.
that's exactly what we just said. And I find this interesting. I'm going to ask you something which wasn't on our route,
Please go ahead.
which is like I've seen that you have consultant for the World Health Organization, so you've got the chance to see, the big picture of it.
Yeah.
And now you work with smaller companies, right, in the health industry. But then when we speak small in Nigeria, everything is gigantic because of the scale of the country and the amount of the people there are, the density of the people, and the complexities that Nigeria as a country itself offer, with the different regions, with how different you are from one state to the other. Why did you choose to go on and move to working with smaller companies?
Interesting. You've just asked a question that is dear to my heart. Healthcare is something you must have before you do anything in the world. I mean, COVID showed us that. During the COVID pandemic, the world practically shut down because there's no health. It's only when you are healthy you can work. And what happens when you are sick is that the first point of call is usually the hospital that is closest to you or the primary healthcare center that is closest to you. So if we keep focusing on the very big hospitals, the tertiary hospital, the quaternary hospitals, what happens to the small hospitals, the small medical laboratories, the small diagnostic centers, the regional centers, the primary healthcare centers, what happens to them? Those are usually the first port of call. Recently, we've had cases in Nigeria that even made a lot of news on the negative side about people that lost their life just because of not having something very essential needed for them to be alive in emergency cases. So that is what drove me and then Cuanu to focus. Typically, we focus on MSMEs, small business, and that includes healthcare. Because when you are sick, that is the first port of call that you go to. And most times when you get to those either community hospitals, community laboratories, diagnostic centers, or primary healthcare centers of the government, you don't see those things that are meant to be there, especially with inventory. In healthcare, inventory is very important. Access to medicine and technology is important. And when we say access to medicine and technology, what do we mean by that? Those essential medicines that are supposed to be at that level of care, are they there? Those essential technologies needed in the equipment, because it's not every equipment that should be in the lab. There's a particular technology that should be in particular equipment. So that informs you the kind of equipment you should buy. That informs you the kind of drugs you should buy so that when somebody comes to your facility, you are able to have that. So that's typically what made me and then us at Cuanu to think about strengthening the healthcare centers in the different localities so that if you are sick and you go to any facility, you are sure that you are getting quality care. And again, we are very heavy on quality management system in the laboratory because in the laboratory, that in fact, almost everybody that gets to the hospital must go to do some tests. You must do your blood work. Is with the blood work, the clinician will decide, are you staying on admission? Are you going to be discharged? Are you going to take more drugs? Is the medication going to change, right? Or is some other intervention going to happen? Are you moving to another specialist? Without it, you'll be flying blind. So we do a lot of that. We teach a lot on the ISO 15189 that is typical to the medical laboratory, which is very important because most times, whatever level of care you go to, you must have your numbers done so that the physician can look at it and see actually what is going on and how he or she is able to manage you. So like I always say, you never know when it's going to be your turn. So why don't we get all these small centers up and running?
Oh, I think we have a connection problem in the middle of the live. Let's see if Nonye comes back. All right. So good morning, everyone. We're in a live with Nonye. She probably just had, yes, she disconnected. She had a internet problem, which is quite common in Nigeria. I will wait a few minutes more so that we can see if she comes back. Meanwhile, what we're talking about is how Nonye and Cuanu, her consultancy, have been working with the healthcare industry in Nigeria mostly. And she was just answering why she chose to work with small organizations with, there she is back.
Sorry about that. Sorry
Yeah, that
about
was
that.
the internet, right? I was
Yes,
just saying that you're
yeah.
why you chose to work with small organizations.
Yeah. Okay. I go all over again.
No, you don't need to go over again because we're still live.
Yeah. Okay. All right. So
Oh no, maybe she disconnected again. There we go. We're back.
okay, great. Okay. So that I was saying that's the reason why we focus on smaller organizations and small.
Oh no. Yeah, Nancy is saying that it's raining cats and dogs in Lagos, so her network is affected. Yes, it is true. I was in Lagos for a month and the internet was bad. That's why I wasn't able to come back with Tuesdays for facilitation. So depending on where you are on the island or on the mainland, your internet might not work well. Let's see if she comes back. There we go. Yes.
Hello, Ty, can you hear me?
Yes, yes. So Nancy said it's raining in Lagos, right? That's why the connection's not that good.
Hello, can you hear me?
Yes, we can hear you. We can hear you. Oh,
So sorry about that. I don't know. Okay.
Lagos is.
Okay. So you might be in an emergency situation. Oh, is it clear? Or do I need to change
Yes,
network?
yes.
Clear. Okay, great. Okay, so like I mentioned, you may be able to call somebody's one day you want to go to a health facility to know which one you should go to. But what if you're in an emergency situation and somebody just has to take you to a hospital close by, to a clinic close by? to a laboratory or diagnostic center close by, what's the quality of that facility? So that's why we do a lot with making sure that all facilities, as much as are possible, that they want to come in and train with us or bring us in for consulting work or either recruitment with what we do, we try to get the best for them so that at any point, anyone that goes to any of these facilities will be able to have proper care because life is very important. COVID has shown us that. Yeah.
I would like to tell you there are some comments here. So Elizabeth is saying this is so profound and important. I think like it was last month, like we have some health cases in Nigeria that got very famous. We had someone dying from a bite of a snake. And
Exactly.
we had the situation with Shimamanda's son, which was a clinical
Exactly.
error also. So
Exactly.
I've seen it on the news a lot. And also because I was in Lagos at the time, I've seen how this has affected people. You know, even Shimamanda,
Exactly.
she had access to the best
Very,
hospital.
very sad.
Yes. AJ said about 70% of clinical decisions depend on data from the medical laboratory, and qualities laboratory is priority. Yes. The other message here is about it's from Nancy. She's saying that it's raining a lot in Lagos, so that's maybe why.
Exactly. Exactly. Yeah, I think that's why the network is crappy. Yeah.
Yes, the network. You know, it's always it's always a surprise. So, Nani, you often work with professionals who are brilliant in their technical fields, right? So we're talking about surgeons, we're talking about lab managers, clinicians. When you bring them into a facilitated space, what is the biggest aha moment that they usually have? Like that they realize that their technical competence isn't enough to lead, you know, a systemic change, because what we're talking about here is impact and change, right?
Exactly. Yes. Okay, yes. Yes, we do impact. And the biggest aha moment is always when we go on the soft skills. Because when we're in school, we're not taught a lot on management, just very introductory management courses. We didn't do much on soft skills. We didn't do much on we didn't even do business at all. It's now that we're having business being taught in the higher institutions. So once we go that route, they're like, aha, so this is the reason why I'm having this problem, right? Because just like you've mentioned, technical competence doesn't mean that you're a leader. They are two different things, okay? And there's also that saying that you're a manager doesn't make that you're a leader. All right. It's only when you're a good leader you can say, okay, yes, that you're a good manager. But most times, good managers may not be good leaders. So go on our soft skills, communication, emotional intelligence, personality profiling. In fact, and you can't do emotional intelligence if you don't know who you are. So personality profiling session is always an aha moment because that is the reason why they see why they do. The blind spot starts coming out, which is very key because your behavior in the healthcare setting is very and your patients. So aha moments we have. Once we go on our soft skills for our management and soft skill, don't know. In fact, I need to learn how to do the business. Those are always the aha moments that we see. And that's what keeps them coming back to us to do more work for them because they now know they have discovered what we do is actually for impact and not just training or facilitating a session. So those are the aha moments that we always see because they are skills. You need to look at the patient and know when a patient is not saying something, or your staff know when your staff is not saying something, and you have to bring it out as a leader to help you in helping that person running your facility.
It's quite interesting, right? Because then we're everyone, I always say, and this is something that I always bring here too, like everyone that works with people needs to learn how to be a better facilitator. Everyone, if you work with people, unless you're like just looking at the machine the whole day and that's what you do, you have to learn, you have to have better facilitation skills because you have to make it easier for people and to help guide people get to a place which is interesting for everyone, right? And when we're talking about patients, for example, we're talking about a situation where sometimes a doctor has to be a good facilitator, helping out the patients to express. A boss, the manager has to be a good manager, for them to understand what their employees want. This is quite important. So about Cuanu, you are around every region. How can we contact you? Where are you in Nigeria? Where are your clients? They're everywhere, right? That's something
Our
I
clients
already.
are everywhere, and I'll talk a bit about that. We moved around a bit, and at some point we were losing clients. So in 2019, we have to move virtual. Little did we know that in 2020, COVID was coming. Yeah, so Cuanu is actually 80 to 85% mostly virtual in its operations, right? And because of that, we cover the whole of Nigeria. And of course, it helps with logistics sometimes when that becomes an issue. But then, of course, those that want us to have a physical session with them, of course, we also do a physical session. So we are headquartered in Lagos, Nigeria, Southwest Nigeria, but of course, we work across all the different and the 6 geopolitical zones in Nigeria. We actually have clients across all those locations. So whoever wants to reach us just need to reach us on our social media handles, just as it's written there, Cuanu Consult Limited. Once you put it there on your browser, it comes up, and then you can reach us with whichever is your preferred mode of reaching us. So that's it. And we're happy to always have people that we can change, because we are about making impacts. We like to be a one-stop consult for whoever comes to us. Yeah.
Thank you, Nonye. I have another message here from Elizabeth Samuel. Soft skill can be overemphasized. It's an essential. Love that you're speaking on this. Thank you, Nonye.
Thank you.
And I have
Thank
to
you,
thank
Elizabeth.
Nonye too for participating, even though we had a little bit of a technical issues here. Nonye, thank you so much.
You're welcome,
Thank you
Terry.
for your strength, for your stories, for bringing this thematic here to choose this for facilitation. And I'm really looking forward to meeting you again in Nigeria.
Sure, sure. We want to have you back with your legal.
Yes,
Sure.
I'm going to be back.
Yes. Thank you,
Thank,
Ty, and your great work you are doing. Absolutely.
thank you, Nonye.
All
Goodbye.
right. Bye.
Bye.
Bye, everyone.